Neurology quiz number 60. Describe the indications, contraindications, and procedure of deep brain stimulation or DBS in Parkinson disease. DBS is an implantable system that delivers electrical impulses to the basal ganglia to modulate the three main symptoms of PD: tremor, hypokinesia, and rigidity. Indications: the goal of DBS is to improve disabling symptoms persisting despite optimal medical therapy. Three major indications are a disabling off state which occurs more than 20% of the day while awake, troublesome dyskinesias when receiving optimal medical therapy, tremor that is not controlled in spite of optimized medical therapy. PD symptoms that are responsive to levodopa are improved with DBS. An exception is resting tremor, which can be improved with DBS even if it is not levodopa responsive. Symptoms that do not respond well to levodopa and DBS include gait abnormality, postural instability, and speech difficulty. Patients should have a diagnosis of idiopathic PD and minimum disease duration of 5 years to exclude individuals with atypical Parkinsonism. A levodopa challenge test should demonstrate at least a 33% decrease in the UPDRS Part 3 score during the best on medication state. This figure shows an overview of the DBS system, showing the electrode in the basal ganglia and the stimulator under the skin. Contraindications: age more than 80 years, psychiatric comorbidity such as dementia, psychosis, and depression. DBS surgery may be associated with postoperative deterioration of cognitive and psychological function, atypical PD, and comorbidities that preclude surgical candidacy. Ideal candidates for DBS are younger, have minimal cognitive impairment, have motor symptoms that fluctuate throughout the day, are high functioning when medications are optimized. Preoperative requisites include neuropsychological testing and brain MRI. Surgical targets for DBS. The major targets for DBS surgery are the subthalamic nucleus or STN and globus pallidus internus or GPI. Of these, the subthalamic nucleus is currently the more commonly used. Studies show no significant differences in long-term control of motor symptoms between these two sites. Patients may have worsening of gait impairment and speech disturbances, as well as persistent levodopa-resistant freezing of gait. These figures show the surgical targets for DBS, the subthalamic nucleus and the globus pallidus internus. The procedure for DBS in brief is as follows. A stereotaxic frame is attached to the patient's head. An MRI or CT scan is performed with a localizing device on top of the frame, which helps to pinpoint coordinates of the target area within the brain. Special computer software is used to plan the trajectory of the electrode. An arc-shaped device is then attached to the frame to plot the coordinates and drive the electrode to the exact location and depth in the brain. A frameless technology is available at some centers. Electrical recordings help to identify the target nucleus. Once the target has been identified, the recording electrode is replaced with a permanent DBS electrode or lead. Finally, the neurostimulator is placed under the skin in the chest or abdomen under general anesthesia. The patient returns to the clinic in 2 weeks' time and the stimulator is programmed. Optimal programming and clinical benefit can require few weeks to 6 months. DBS surgery may be performed bilaterally at the same time or with each side staged at different times. Complications include intracranial hemorrhage, stroke, seizures, infections, and hardware dysfunction. Medical issues such as myocardial infarction, pneumonia, deep vein thrombosis, and pulmonary embolism. These are reported in a small percentage of patients. Side effects may include paresthesia, dysarthria, ataxia, and mood dysregulation, which are typically reversible and can be relieved by changing the stimulation parameters. DBS is also used to treat the following conditions: essential tremor, dystonia, epilepsy, obsessive compulsive disorder.